a city hospital is a poor hospital. At the 111th plenary session of the City Council on November 7, Deputy Mayor Seo Won's answer to City Councillor Kim Mi-ra's municipal administration question shows Seongnam's perception of public health care. At the time, it is actually difficult for the head of the health center to handle university hospital attraction, and it must be done combination. Currently, I don't think the city hospital is suitable for some organizations to establish a city hospital. City hospitals are really necessary for medical vacancies, but medical vacancies have no medical centers at all. This is the medical facility. If there are no medical facilities at all, such as in remote areas, it is a city hospital that local governments risk various deficits, because it is a medical vacuum. Currently, there is no new city hospital in the country. I think that there is medical inconvenience due to the closure of Inha Hospital, but there is no medical vacuum, so some organizations are medical gaps. So please establish a city hospital, and I don't think it's appropriate for this. When Kim Mi-ra, a city councillor, said 120,000 people signed it, and that it was a long-cherished wish of Seongnam citizens, the deputy mayor replied as follows: "You said 120,000 people signed it, and I don't think those citizens signed it, even though they knew there were so many problems with the city hospital, despite the deficit that the city hospital would bring. And, as I said before, the city hospital was a city hospital when there were no medical facilities at all, in the 50s and 60s. Currently, in our city, the hospital is gone, so it is inconvenient for people living near it. Therefore, we have adjusted bus routes to Seoul National University, Bundang Hospital or Bundang Cha Hospital, and we are doing our best to resolve medical inconvenience. If it's a municipal hospital, of course, it's comfortable for the people in the area, but the city's budget, all taxes paid by our citizens, for example, the part that needs the city's budget, of course, has nothing to do with this agenda. But how good would it be to make all of the second industrial complex parks? It's 200 billion won to buy 30,000 pyong. Residents of Gumidong asked the city to pay 200 billion won for the undergroundization project of power lines. The city can't do it all at its own expense. It'd be nice to make a lot of city hospitals. I made it in Jungwon-gu and Sujeong-gu. However, as an administrator, I disagree with our city's opening of a municipal hospital that was done in the 50s and is now gone because of medical inconvenience. Although there is no medical gap at the moment, Deputy Mayor Seo confirmed that it was a medical inconvenience, not a medical gap, and that there was no need to build a municipal hospital for the relief of the poor in the 50s and 60s. The deputy mayor added, and we will push to attract university hospitals and reopen Yale Hospital. The city will help with a loan.